Thank you very much, Mr. Chairman. I'm going to use this round to ask some questions of CBO and joint tax and reserve until later my final comments. And I'd like to focus first, Dr. Elmendorf and Mr. Bartold, on the cost curve. We've heard a lot of talk about the fact that this bill bends the cost curve, but I'd like to make sure we are talking the same thing. When my constituents, and I think most people in America, talk about the need for health care reform, they talk about the fact that the skyrocketing costs of insurance and other health care costs have to be brought under control. Has CBO scored that cost curve?
No, Senator. I appreciate your raising this issue. I think it is very important to be clear about this. What we've written in our letter to the committee is that we've evaluated the 10-year budget effects, of course, and also the longer-term effects on the federal budget. We have not evaluated the effects of the proposal on national health expenditures, either within the 10-year budget window or beyond that window.
Thank you. And so those who say that this bill bends the cost curve must be talking about something else. And that, if they're referring to your CBO score, that means that you're talking about the cost to the federal treasury of the net provisions in the bill, correct?
I guess so, Senator. In my experience, people use the term the cost curve and bending the cost curve sometimes to refer to the federal government's situation and sometimes to refer to the national situation. And we're trying to be as clear as we can about one versus the other.
You have made no statement or issued no conclusions about the impact on the national health care cost curve.
That is exactly right, Senator.
Could I ask you, with regard to the cost of insurance, I know you didn't score that and that's not a part of your CBO letter, but I believe, and I can't recall whether this was you or Mr. Bartold, but I believe in our previous hearing, or parts of the markup, you indicated that although you haven't scored it and don't have specific numbers, that the overall impact of this bill on the cost of health care insurance will be to drive the cost of that insurance up. Is that correct?
So that is not a conclusion of ours, Senator. What we've said in a separate letter to Senator Baucus a few weeks ago is that there are a variety of forces working on affecting private insurance premiums and the amounts that people would pay for health insurance. And some of the changes in the proposal would tend to push down those premiums, some would tend to push up those premiums. And because there are so many conflicting forces, we have not been able to assess the net impact on premiums. And I understand that our inability to do that is unfortunate from the committee's perspective. It's unfortunate from our perspective. The best we've been able to do is to list the criteria, the factors, talk about the magnitude of some of them, but not to draw an overall conclusion.
Thank you. Mr. Bartold, have you reached a conclusion in that regard?
Senator Crapo, we don't, the Joint Committee on Taxation does not analyze the totality of costs. The limited areas in which we spoke over the past couple of weeks related to the insurance industry fee that is in the mark and the high premium excise tax.
All right, thank you. Because of time, I want to keep going here.
I'm sorry.
Let's go back to the federal treasury and that which the CBO has scored. With regard to that, there is spending and there are tax increases and there are reductions in spending in this mark, correct?
Yes. And yes. There are increases and decreases in both taxes and spending.
Correct. And let's just look at the spending side of the ledger. Is it fair to say that this mark will increase federal spending by hundreds of billions of dollars on health care?
Yes, Senator, that's correct. I just use a few seconds of your time to note that in the analysis that we've done with the Joint Tax Committee, we have not broken out the effects in the traditional way of the spending side and the revenue side of the budget. We focused on the net effect on the federal deficit, and we say in our letter there are some further aspects of the bill that we would need to do, and we will do in a formal cost estimate to flesh out.
I understand, but the point I'm getting at is this. For those, even those who want to talk about the cost curve in the context of just the impact on the federal treasury, would it not be accurate to say that the net impact of the mark is to increase federal spending and to offset that spending by more taxes?
I think so, Senator, but I want to be a little careful. So what we've reported in our letter is that Medicaid and CHIP outlays, which truly are outlays, will be up by $345 billion over the 10 years. Then there is $461 billion of exchange subsidies, some of which would appear as reductions in revenue from lower tax liabilities, some of which I believe would appear as increases in spending because they would be refunded parts of tax credit.
Correct.
We have not broken that out. So
I
don't
understand,
really
and
know.
I'm not asking you to break out specific numbers. I'm asking you to just clarify that the net impact of the bill is to increase federal spending and to offset that spending by some cuts in other areas, but cuts which are outstripped by spending, and then making up that difference with tax increases. Is that not a fair assessment?
I believe that's right, but again, just to be clear, the $345 billion of extra Medicaid and CHIP outlays, there's also about $400 billion of reduced spending, mostly in Medicare. The net of those two, the extra Medicaid outlays and the reduced Medicare outlays, is actually a reduction in federal spending.
Well, wait a minute, though.
believe-
The net result of your letter, if I read your numbers correct, is hundreds of billions of dollars of net, when you net out everything on the spending side, hundreds of billions of dollars of increased spending. Is that not correct?
Well, again, I'm sorry, Senator, but we've not really done that netting. So I'm saying that the large pieces that are clear, there's a significant increase in Medicaid and spending, significant reduction in Medicare spending. Then there's this exchange, and in that case, the reduction in Medicare spending more than offsets the increase in Medicaid spending over the 10-year window. But there are also these exchange subsidies that would partly appear on the spending side and partly on the revenue side. My guess is that there would be enough extra spending there would be a net spending increase. But I'm afraid that we just haven't done that breakdown. I don't think that the Joint
Well,
Committee...
I see my time's up. I'll come back in the next round, but I think it's very clear from the numbers in your charts. You can just do the math.